Welcome to the Health Deli, your local stop for a fresh take on community health topics. Come on in, grab a number, and let the guys behind the counter, Mark, Ben, and Mike, tell you about today's specials.
Good day. Welcome back to the deli. You got Mike over here in the sundries, and unfortunately, I am joined by the other two.
But
Unfortunately, come on.
Yeah, it's your boy, Ben.
Somebody's got to be working the
Ben,
meat
you're
counter.
young enough to be my boy. So,
That's probably true, actually.
oh, man. Hey, Andrew, how's it over there in the beverages?
Yo, doing good.
You know, we're in this nice, beautiful new facility here, and you don't have a microphone?
We need another microphone.
I mean, and Lawrence is sitting over there helping out, going, you know, back in the day, they used to let Forrest talk a lot more.
Right.
Got anything to say for the people, Lawrence?
I'm happy to be here.
Hey, you
should
don't have
see-
to lie to us.
You should see his face. He's like, if I wasn't made to be here, I would be anywhere else.
That's one thing Forrest was never going to say.
Well, no, he didn't have to. It was implied by the facial expressions.
That's true. That's true.
Wow. So, hey, here we are, season 3. What's cooking? What's cooking over there in the bakery area?
Am I the bakery?
You're the bakery.
I'm the bakery.
He's Meathead Mark.
Oh, that's right.
True. So I'm still putting together pieces for the kind of air pollution episode, talking about how that kind of affects our health and what we can do about it. So, yeah, that's what I've been working on. Should be a pretty cool episode.
Yeah, and with winter just around the corner, I've been working on an episode about seasonal affective disorder and maybe how to recognize it, prevent it, treat it, everything about it.
All right. And again, personally, I've had some time off, so I've had a little time to think about things. And yeah, I'm working on some stuff related to some, new diseases that are, being introduced in the United States, leprosy, kind of talk about, the biblical thing, the lepers and all that kind of stuff. I want to talk about vertigo. Also, do you guys remember mad cow disease and chronic wasting disease? I want to talk about some of those spongiform encephalopathies, which is really tough to say. Also want to talk about the impact of good health on outpatient antibiotic use. So we always talk about reducing needless or unnecessary use of antibiotics. I want you to take a role in it and see how that affects things. And then lastly, Mark, you're going to love this one. I want to talk about something I just learned about: cultivated meat. Not cultivated like on a farm, but in a test tube.
Really?
Is this going to be like our artificial meat episode, or is this like an evolution on that?
I don't know if we can get cultivated meat. I might have to grow some in my bathtub.
Wow.
And bring it
I
in.
think I am right now.
Oh, dear heavens. Well, now that we got all this taken care of, as Captain Shang, or at least Shang from Mulan would say, let's get down to business.
Let's get down to business.
Well, also relevant here, he said, did they send me daughters when I asked for sons? But anyway, take that how you will.
I'm a son.
Yeah, really? Well, why'd they send me daughters?
All of those with comments. Again, the Health Deli at Ferris.edu.
All you Disney lovers. So I want to talk about something that I never thought I'd have to, again, talk about in the United States, and that's malaria. Okay, it was, very common. Malaria was very common in the United States, back in the 1800s. But we've done a good job eradicating malaria for the most part, domestic cases in the United States, until recently.
So, Mike, I actually, when I was a trainee, saw a couple patients with malaria, but I believe they came from other countries.
Correct.
Is that more where we see this?
And
then?
that's historically, for the past 20, 30 years, all the cases of malaria have been from people who had traveled to other countries and then come here. So it was really, that was the risk factor. This past year, there had been 9 cases of malaria, domestic cases of malaria, that have been diagnosed. There's been 7 in Florida, 2 in Texas, and 1 in Maryland.
Interesting. So these patients didn't leave the country. We think they got the malaria here from mosquitoes here, which I'm sure we'll get into.
Correct. And again, like I said, this might not sound significant, but there had not been any domestic cases of malaria reported in the United States since 2020 or 2003.
So
It's been 20
20 years
years.
ago. Wow.
And, at that point in time, there was a little outbreak in Florida where there had 8 cases. So to have 9 cases spread in these different states is kind of alarming.
Mm-hmm. Yeah, that's absolutely wild, because I agree with you. That's something I didn't think we were going to have to worry about. And there's a potential that it could get worse, right? Because this is a communicable disease.
Well, it spreads, and we'll talk about how it spread and why it's important. And in the United States, we really don't think about malaria a whole lot, but this is more of a global, concern. And every year, there's about 240 million cases of malaria and almost 620,000 malaria-related deaths that occur worldwide. And so that's a fairly big burden of disease. But before we start to freak out about, okay, we got 9 cases and everybody's going to die, world's coming to an end and stuff like that, which it very well may, but
Probably not.
Most likely not due to malaria. Currently, about 95% of malaria cases occur in Africa. And most of all of the 2,000 cases, like you were mentioned in the United States that were reported last year, were with people that had traveled to areas where the disease was present and very common.
So, Mike, I don't know if you're going to get into this, but why is that? Why do we see just so much more of it in other countries, but not here in the United States? Are we just better at treating it? Are we better at stopping it from spreading?
No, we'll talk about that in a little bit, in terms of how it's spread and the mosquito. So malaria is a mosquito transmitted disease. And we'll talk a little bit about that in a moment.
Okay.
And, honestly, it would really help if you read the script a little bit beforehand so you know what's coming. But anyway.
Wait, there's a script? Oh, okay.
Y'all know I can't read.
I'm going to write
Let me
you
check
guys
my
out
email.
of every script. So again, back to the seriousness of this in terms of the patients, the 2,000 that get cases that are diagnosed in the United States. 300 of these people experience severe disease and end up in the hospital, and 5 to 10 people with malaria, of these travelers die each and every year. Now, fortunately, if these people were going to travel medicine providers before they travel to these high-risk areas, you can get malaria prophylaxis, which will greatly reduce the likelihood that you're going to acquire malaria if you travel in these areas.
Yeah, and by malaria prophylaxis, you mean they can take a medication while they're there, so that way, even if they are exposed to malaria, they won't get it, right?
Correct.
Yeah.
Now, the reason I bring up this whole malaria in the United States, in 9 cases doesn't seem like a big deal, but the concern that I have, which is also shared by a variety of other individuals, is global warming. And as we have global warming, and I think alluded to this a little bit before with ticks, and how ticks have migrated from the southern areas of the country north as the climate has changed. So, that goes with Lyme disease and, some of those other things. And that happens with mosquitoes as well. Some mosquitoes are indigenous to certain climates. And as the change occurs, those mosquitoes are able to travel to different areas. And the Anopheles mosquito is the species that transmits malaria.
Okay, so that's not the kind of mosquito that's everywhere. It's only in certain areas then, I'm guessing?
Well, we'll talk about that, where it's been and where it's going. But, to fully disclose this, we've talked a lot about malaria. This is not an episode on malaria.
So wait a minute. We've talked for 5 minutes about malaria, and this is not a malaria episode?
It is not a malaria episode.
So what kind of episode is it?
It's an episode about mosquitoes and mosquito-borne diseases.
Okay.
So can you see follow me along here, connect some dots?
I'll try.
Yeah, I know it's hard for you unless they're numbered in very big dots. We're going to focus on mosquitoes that live and spread diseases, specifically in the United States. And even in the United States, there's more than 200 different species of mosquitoes. Now, the most common mosquitoes actually don't even carry diseases. They're just out there and being a nuisance. And there are only 12 species of mosquitoes in the United States that actually carry pathogens that will spread disease. But before I get into some of the specific diseases, I want to talk about some mosquito numbers. Okay?
Mosquito numbers.
Skeeters.
Skeeters.
Skeeters sounds better coming from Mark than Ben.
There's a skeeter. Oh, never mind.
Yeah, I don't even want to know where you got your skeeters.
Nope.
Now,
Not touching it.
mosquitoes are found all over the world. However, they function best at a temperature of around 80 degrees Fahrenheit, but can survive in colder temperatures by hibernating throughout the winter. And that's why you find mosquitoes in areas like Alaska and Michigan and stuff like that. There's roughly 100 trillion mosquitoes in the world at any given time.
How could you possibly know that?
I counted.
Okay.
It took me a little while, but I counted all the mosquitoes.
Yeah, you had to borrow some other people's hands when you got over 10, but, we got there.
Yeah. A lot of people. Here's another interesting fact. Only the female mosquitoes bite.
Oh,
So, we had talked about that, I think in the past. So you've got the male mosquitoes and the female mosquitoes, but only the female mosquitoes bite, and therefore the female mosquitoes are the only ones that transmit disease. And so just taking that into account, there are roughly 220,000 biting mosquitoes per person in the United States. So there's 220,000 mosquitoes that are chasing Ben at any given time.
so we are horribly outnumbered then.
Oh, yeah.
That's what you're trying to say.
Yeah, just roll over, expose the your stomach, and just let it go.
I'm not going down without a fight, though. So you better talk about how we can start combating this, Mike.
We'll talk about that a little bit.
Thank goodness.
So with the mosquitoes, it's important to know that there's a life cycle that they go through. And let's start after a female bites. We're going to use Ben. Ben is a blood source.
Oh.
So a female bites Ben and has a blood meal. And after that, she lays eggs on or near the water.
Oh, I thought you were about to say in me. I was like, I don't want that.
No, those are aliens.
Okay.
On or near the water or soil, and in some places, that are filled with water. In some cases, something as small as a pop top filled with water, they can go ahead and use that. And eggs can survive under dry conditions for a few months. However, when those eggs are then exposed to the water, they hatch. And when they hatch, what comes out are called larvae. And these are called wigglers. And these wigglers live in the water and molt several times before they emerge to the surface of the water and come out as pupa. These pupa are also called tumblers. They got a lot of little nicknames.
I love all these
You're
names.
making these up.
I'm
aren't
gonna
you?
call
We got
Ben.
wigglers,
Ben is
tumblers,
Ben's the
skeeters.
wiggler. Mark is the tumbler. This is not a feeding stage, and I'm the adult. So I'll be the adult mosquito.
You can tell Mike wrote this episode.
Right.
And I can fly around, after emerging. And this is after all. This sounds weird now. After my body parts have hardened, and so that's the adult mosquito. And it's the adult then female that will end up biting. And depending on the conditions, the cycle can take up to weeks, but it can range from 4 days to as long as a month.
Now, how long does a mosquito live? I know some insects are very short-lived. I mean,
Mosquitoes are typically short-lived. They don't have a great lifespan.
lifespan.
Again, days to months.
I haven't seen any flying around with walkers or wheelchairs or anything.
Yeah, right.
Carrying a social security card.
Can you like zoom in on my face? Got it.
So a little bit more of a serious question. So if the mosquito has malaria or some other disease in it, and then it lays eggs, will its larvae and pupa then also be like carrying that disease?
No.
Okay.
So let's talk about a little bit about the mosquitoes, and let's talk about how mosquitoes actually get those pathogens in them.
Okay.
So it's important that there are a variety of different mosquitoes, and only certain mosquitoes carry diseases. So it's important to know what mosquitoes are living in your area and what you might be at risk for if you're bitten. And the three most common types of mosquitoes in the United States are the Andes, the Anopheles, and the Culex mosquitoes. The Andes, if you look closely at them, which I never have, apparently have narrow black bodies with legs and alternating bands of light and dark. So, Mark, as you're out on the farm, catch your mosquitoes or your skeeters and check out what they look like.
I know you're saying that as a joke, but I routinely catch insects and identify them because they could be pests in the grapes or blueberries. Although I've never paid any attention to mosquitoes because they're not really a fruit pest. But I'm going to start identifying the mosquitoes.
All right,
I
and
catch.
you let me know if you find some Andes up there.
I
Because,
will.
these are starting to spread over greater areas. Unlike most mosquitoes, these Andes mosquitoes are a little different because when we think about when mosquitoes attack, we usually think about, at night or at, when it's getting dark at dusk. And these mosquitoes are active and bite during the daytime. So it's a little bit different. And the Andes mosquitoes typically, transmit diseases like Zika, dengue, chikungunya, and other viruses. So your risk for acquiring these diseases is greater during the day because that's when these mosquitoes are active. In the United States, these mosquitoes are mostly found in the southeast and south central parts. However, we are now seeing them all across the United States. The other kind of another kind of mosquitoes in the United States is the Anopheles mosquito. And there's 460 different species within this genus. And so again, remember species, genus, phylum, king, all that kind of stuff. The mosquitoes in this genus, these are the ones that transmit malaria throughout the world. And these are most active from dusk to dawn. And that's why one of the things that they say to prevent malaria, sleep with bed netting, to cover you while you're sleeping.
Okay, because that's when they're active.
Are these
Correct.
more in warmer climates than?
Historically, yeah.
Okay.
But again, as we've seen climate change, we've seen the spread of these mosquitoes work their way northward.
The range is expanding.
Yes, kind of like your vocabulary hanging around with me.
Ooh, nice.
So the last type of mosquito that I wanted to talk about is the Culex. And the Culex is found throughout the United States. And this is the most common type of mosquito, and it's just a common house mosquito. Typically, this is just a nuisance. However, the Culex mosquitoes are responsible for transmitting diseases like West Nile virus and Eastern equine encephalitis, along with some other types of encephalitis. So they can be problematic. And in the state of Michigan, we did have problems with Eastern equine encephalitis a couple of years ago, especially a lot of cases in Michigan. I'll talk a little bit about that. And the Culex mosquitoes are most active between dusk and dawn.
So would you say that here in Michigan, where we all are, if I get bit by a mosquito, it's like 99% chance it's a Culex mosquito, or are we seeing more of these other ones up here now?
We're starting to
too?
see more of the other ones up here as well. I would say the majority of them, you're going to get some Culex, probably some, Andes mosquitoes as well. But again, the ranges are changing, and it used to be a little bit more demarcated in the United States where you would find things, but now those lines are starting to blur.
And that's probably going to just continue to blur even more as we get more and more shifts in the climate, right? So
I would imagine so.
Yeah.
Now, before we go on and talk about mosquito-borne diseases, let's pause for a minute and hear from Mark and get our Healthy Minute.
Well, thank you. Let's pause for the Healthy Minute brought to you by the Winery at Young Farms. Today's Healthy Minute topic is get enough sleep. Adults should aim to get at least 7 hours of sleep per night. Lack of sleep has an impact on nearly every aspect of your mental and physical health. If you are having trouble getting enough sleep, you should make sleep a priority and schedule your sleep times as necessary. If you still can't fall asleep, make sure that your room is dark and free of devices and other distractions, and try to increase your level of physical activity throughout the day. If you are still having trouble falling asleep, there are non-prescription and prescription medications that might help. Talk to your doctor or pharmacist for options. That was the Healthy Minute, brought to you by the Winery at Young Farms in Mecosta, Michigan. Please visit www.thewineryatyoungfarms.com for more information. Now, back to the Health Deli.
Could we read that again like we're not falling asleep, please?
Sorry. Aw. Okay. Do you really want me to read it again? No. Jeez.
I was going to say, and another sleep aid is listening to Mark talk. I mean, he's got
Yeah, it really
that-
could be. I
that
should have an
sultry
app,
voice.
Yeah, we should. We should just record Mark lecturing.
I
Is that
could-
why so many
I
students
could read,
fall asleep?
probably. That's why they sign up for my sleep elective.
Womp, womp, womp.
Wah, wah, wah. Yeah.
Oh man. Well, let's get back on track. And talk about mosquito-borne diseases. And one of you guys asked, I forget because I barely listen and register what you two talk about.
If it was a good question, it's probably me.
Let's
be.
say it was Mark, but I think it was Ben. Asked about how the mosquitoes pick up the pathogens and stuff like that, and whatnot. And the way this occurs is that when the females are out there biting and having blood meals, they can feed on an infected host. And that infected host could be a human, it could be a rodent, it could be a horse, it could be anything. And they're going to pick up the typically viruses, from these infected hosts. And then that pathogen multiplies in the mosquito's abdomen. And then it's transmitted, to an uninfected host when it bites them. And then it's transmitted through the saliva. And gets injected into, the host that it bites.
So essentially, it's coming in from the blood that they took from that other organism, right? And then it's not really infecting the mosquito. It's just kind of hanging out inside of it, right? And then it just goes into wherever else it bites, right? Is that kind of how it works?
Correct. So the mosquito itself does not get infected per se. It carries the infection, so it becomes a carrier.
So I guess it's just not harmed by it.
It's
then,
correct.
right? Okay.
Correct. because it's like being a chronic carrier of something.
Mm-hmm.
Okay.
Interesting.
Now, according to the Vector Disease Control International, or VDCI, the 5 most common domestically acquired mosquito-borne diseases in the United States are West Nile virus, dengue, which I had never thought that was going to be something that was going to be that important in the United States,
Yeah.
lacrosse, which sounds like a sport, Eastern equine encephalitis, and Zika.
Okay. And yeah, I know I haven't really heard a lot about a lot of those, or, I have, but they're not in the news that much, except for Zika. That one I know had an outbreak somewhat recently.
Right.
But the other ones we don't really think about all that much, right?
Well, let's talk about them and how common they are in what's going on. And again, West Nile is probably the most common. And in 2022, there were about 1,000 human cases of West Nile virus in the United States. And this resulted in 79 deaths. Now, this has been down from previous years. I think it was probably in 2021 through 2024 is when we first started seeing West Nile in the United States. It started on the East Coast, then every season's kind of progressively worked its way westward. And so it started on the East Coast. The next season it came to the Midwest, but we really didn't see cases on the East Coast. And so it kind of worked its way across the United States and now is prevalent across the United States, but at much lower levels.
Interesting.
And so, like I mentioned, the first case was reported, in 1999. And now because of, its history and transmission, it's now considered endemic in the United States. The mosquito that transmits West Nile is the Culex mosquito.
And those are the really popular, the most prevalent one, right?
Right.
Yeah.
Right.
Most common.
And the mosquitoes pick up the pathogen by biting birds. Okay. And then they will go ahead and spread it to humans. And so one of the things when we first had West Nile, there also used to be a lot of mortality among birds. And so we would look at dead birds to screen them for the West Nile virus. Currently, the states with the highest incidence of West Nile are Colorado, California, New York, South Dakota, and Nebraska. Colorado had 204 cases, California 168, and the others quite a bit less than that.
So this was originally, I think, I could be very wrong on this, was found in the crow population a lot. You'd see a lot of dead crows. And whether they're living or dead, it's still a murder of crows.
Correct.
Huh.
So
I guess the way a murder of crows.
isn't that what you call a group of crows?
That's what a group of crows is called, yeah.
Yeah.
They're called a murderer?
A murder.
A murder, yeah.
Of
So like,
crows.
yeah, so like a herd of bison, but a murder of crows.
Yeah.
Okay.
Some of the smart
so
people
now
would
my
get that
question
joke.
is, how the hell did Ben know something like that if it didn't, have to do with punk pop stuff? Or...
I am a learned doctor, Mr. Klepser. That's right. I didn't call you doctors.
Wow.
Well, let's get back to West Nile and ignore these guys for a minute. So in terms of symptoms for West Nile, most people don't experience any symptoms, probably about 80%. However, some people do go on to develop symptoms, including getting a fever, and about 1 in 5 people who are infected develop a fever and other signs and symptoms like headaches, body aches, joint pains, vomiting, diarrhea, and so forth. People that experience this febrile illness can completely recover. However, the fatigue can last for weeks to months.
So you're talking about these symptoms, Mike, and this really just kind of sounds to me like influenza, like just kind of a normal seasonal flu that you might get.
Yeah, and it's been very difficult because they're fairly nonspecific. And it's really kind of, you don't come in and go, hey, you might have West Nile.
Right.
It was just one of these things like, you really have to think about it before you can make a definitive diagnosis. And one of the reasons it might be important is because even though most people fully recover or don't have symptoms, about 1 in 150 people who are infected develop a severe illness that can go on to affect the central nervous system and cause inflammation of the brain, called encephalitis or meningitis. And in this case, symptoms include high fevers, headache, neck pain, kind of looking dizziness and disoriented. They can have coma, convulsions, and all the other, crazy, not happy things. Severe illness is most likely to occur. It can occur at any age, but the very young and the very okay, this is not very old.
How
People
old is it?
over 60 are at greatest risk.
You passed that number a long time ago, Mike.
Did I miss you guys? No, did not miss. And also certain people with cancer, certain medical conditions like cancer and diabetes are at risk. Recovery from severe illness might take weeks or months. 1 out of 10 people with severe illness will experience death.
So that is really unfortunate that some people do die from this, but it seems incredibly uncommon. So you're essentially saying 20% of people who are infected will have symptoms, and out of those, only like 1 in 150 will be severe, and then out of those, 1 in 10 will die. So like very, very small percentage of people will have that.
Right. So I'm not saying stay inside, never go outside, and put a plastic bag around your body. But there are measures that we'll talk about later that you can protect yourself against mosquito bites.
Yeah, because I mean, I don't want to be that 0.1%, but
Well,
yeah.
The other thing is this could be a very underrepresented disease because I think it wouldn't be what I thought if I was just feeling a little bit down and recovered. I'm never going to get tested. So the true number, we really don't know. I mean, it could be much higher.
Right. Now, the downside of this, like a lot of these diseases, if you get it, not much we can do. It's pretty much rest fluids and take over-the-counter pain medications to relieve, pain and fever and stuff like that. And that's going to be a recurring theme with a lot of these mosquito-borne diseases.
So we don't really have any like antivirals that will fight it off?
No.
Okay. So that's one of the reasons why prevention is so important.
Correct.
Which I'm sure you'll stress when we get
Correct.
to it.
The next disease I want to talk about is dengue. In the United States in 2022, there were about 1,070 cases. Fortunately, there were no deaths.
Okay.
And this did, however, represent an increase, between 2021 and 2022. But we have to take that with a grain of salt because the pandemic. And at that point in time, a lot of these people weren't traveling. So we thought maybe there's this increased risk because maybe we got some domestic cases and then maybe we got some travel cases built in or people just traveling to different parts of the United States. The mosquito that transmits this is the Andes mosquito. Interestingly, the only reservoir for this virus is humans.
Really?
So, the humans are infected. The mosquito has to bite an infected human and then transmit that to another pathogen or to another host. Historically, these mosquitoes are found mostly in the southeast and south central parts of the United States. And even before that, it was mainly considered a disease of, more tropical countries, Central America, South America, and so forth. Unlike what you think about typical mosquito environments, being in the woods and stuff like that, these mosquitoes can be found in cities. And they can replicate in very small amounts of water, like estraws, gutters, tires, and stuff like that. So this is a disease that you see in a lot of cities. And in the United States, the states with the highest number of dengue infections include Florida, Puerto Rico, California, and New York City. So 3 warmer states. And New York just gets a lot of diseases, and most likely from travelers and stuff like that.
So one thing I just want to have a point of order, just because you call me out all the time, Mike, I don't think Puerto Rico is a state.
No, it is not. It is a territory still at this point in time.
Don't tell a Puerto Rican that, though.
Well, yeah.
It's a very contentious issue.
Is it really?
It is, yeah.
Oh, dang.
Yeah.
Well, then cut that out of the podcast. Then.
Yeah, they want to be state, I think.
No, they vote it down all the time.
Oh, really?
Yeah.
I thought they voted to try to get in to be a state.
Some of them did, and I think they continue to vote it down.
Oh, okay.
So I really have to teach you guys a little bit more about civics and government and stuff like that. In terms of the symptoms for dengue, about 1 in 4 people will get sick if they're infected with dengue. And the people who get sick, most of the symptoms are mild, but some of them can get severe. And that occurs in about 1 out of 20 individuals. And this can be life-threatening, actually even within a few hours becoming infected. And the most common symptoms with dengue are nausea, vomiting, rash, aches and pains, even eye pains and behind the eyes. Typically, symptoms with dengue will last about 2 to 7 days, and most people recover in about a week. Now, again, there's no specific treatment for this. However, dengue is kind of related disease state to chikungunya. And chikungunya is associated with a lot more bleeding problems. Because of this, they say don't take aspirin or ibuprofen if you've got dengue fever, because that will increase your risk for bleeding. Now, there is a dengue vaccine that's approved for use in children in the United States, aged 9 to 16 years, with laboratory-confirmed previous dengue infection and living in an area where dengue is common. So the continental United States, it's probably not going to fall into that category, but areas, some of the U.S. territories, that would be common, again, like Puerto Rico, Guam, others like that. The vaccine is not approved for use in U.S. travelers who are visiting to those areas. So that's important to note that it's there, but very strict usage criteria.
Interesting. Do you know why that is, Mike? Are there like a lot of side effects with it, or is it just kind of expensive, or we don't think we need it if you're just there for a couple days?
I think that the risks and costs associated with it probably outweigh the benefits of the vaccine. I'm not sure how long it takes to build immunity. Most people don't think that far ahead, and stuff like that. So, that's my best hypothesis.
Yeah, probably more of a logistical kind of thing. Makes sense.
So the next disease I want to quickly talk about is the lacrosse virus disease. There were only 22 human cases in the United States in 2022. This is spread to humans by the Andes mosquitoes. It does have an anal reservoir of the squirrel and chipmunk, and this is found most commonly in the southeast and south central parts of the United States. Most people that are infected, again, don't have symptoms. So that's kind of a recurring theme with a lot of these, is that they don't have symptoms. But there's a significant incubation period with this. So unlike dengue, where you can get sick very quickly, this might take 5 to 15 days before you start to see some initial symptoms. And the initial symptoms would include things like fever, headache, nausea, vomiting, lethargy. So again, very nonspecific.
Yeah, and they cause, again, that like inflammation of your meninges or your CNS, your central nervous system. So they're all kind of very similar in that
Right,
way.
and that's the big risk for some of these, is that even though a lot of people don't get bad symptoms, there is a risk for some very serious outcomes. And that's the case, again, with this lacrosse, virus, like you said, that can cause encephalitis and whatnot. But again, unfortunately, no treatment except fluids and rest. And that kind of like leads us then to Eastern equine encephalitis virus, or triple E. And in the United States, this has been relatively uncommon. Only about 110 cases from 2011 through 2020. However, there were 19 deaths. And in 2019, there were a spike. There were 38 human cases and 19 deaths that were associated, with Eastern equine encephalitis. And this is actually spread by two different mosquitoes, the Andes and the Culex. The reservoir is the bird. So, okay, wait a minute.
So equine encephalitis and the reservoir is the bird?
The bird. And the reason that is because the horse is a terminal host. So if a horse gets infected from a mosquito, which horses can get bit by mosquitoes, they will die. It's a higher mortality, that, so it's a dead end virus. Whereas if it bites a human, they don't kill all of the infected individuals. Now, most people, again, with triple E, don't have symptoms. But for those that do acquire the symptoms, the incubation period, so the time from being bitten to the symptoms, is about 4 to 10 days. And typically we see things like fever. This can progress to neurologic disease, including meningitis and encephalitis. And the type of illness depends greatly on the patient's age and a variety of other factors. So again, this can be very innocuous in a lot of people, but approximately about a third of all people with triple E die. So there is a considerable amount of mortality. And death usually occurs 2 to 10 days after the onset of symptoms. Even those that recover from Eastern equine encephalitis virus do go on to have long-term physical and mental impairments. And so again, I don't know if you guys remember back in 2019, actually a lot of cases were identified down in my neck of the woods in Kalamazoo. And they were canceling football games. They were having people recommend stay indoors, not go outside. There were a lot of concerns with pets and everything else. So it was pretty scary. And when all this was going on, I got a call from my father. And he told me, hey, be careful down there because this is really serious stuff. Because I guess, and I had never known this before, my father had a younger sister, who they believe caught Eastern equine encephalitis virus when she was 8 years old and died.
Oh, wow.
And so he was very, concerned about the whole thing. And so that, just kind of brought things home.
And that still makes the news up here. Just a couple of weeks ago, our local county, it was on the television that there was one reported case in a horse. And my daughter loves horses and takes riding lessons. So, of course, we were, extra vigilant about long pants and those kinds of things.
Yeah. So the last disease I'm going to just mention quickly is Zika. Zika got a lot of press a few years ago. It seemed like there were a lot of cases down in Florida. 2022, no cases, in the United States. This is spread by the Andes mosquito. And really the big thing here is there are some significant concerns related to if a pregnant woman contracts Zika and what that does to the fetus. Again, no treatments.
Yeah, so we talked a lot about how there's no treatment for any of these. Some of them are very serious, can have very serious symptoms and kind of outcomes. So what can people do to avoid mosquitoes and potentially getting some of these?
Yeah, exactly. And the best thing is don't get bit. So know when the mosquitoes are active, dusk to dawn versus day biters. If you go out and there's mosquitoes present, you're supposed to wear light-colored long-sleeve shirts and pants. And protect yourself as much as possible, but then also apply mosquito repellent. And according to the Centers for Disease Control and Prevention, you need to apply these. They recommend, I think, 5 different agents, and they come in different percentages, which we're all kind of familiar with the percentages. And all the percentage means is you can probably go a little bit longer without reapplying.
So it doesn't work better, just lasts longer.
It just lasts longer, right? And so the most common things that we see are DEET, Picardin, this goofy thing called IR3535, oil of lemon eucalyptus, and 2-undecanone. And DEET is the thing that's most commonly used, and this stands for N-N-diethyl metatoluamide. So a lot easier to say DEET.
Yep.
And key thing here, use about 30%, at least no more than 30% on kids. And, the thing to know about this is it does not kill mosquitoes. It just makes it harder for those biting bugs to smell us because it, creates its own smell. There's always been a little bit of debate about safety of things like this. And according to the EPA, DEET is highly safe among a variety of different patient groups and so forth, as long as it's not ingested. When you're applying DEET as well as the other things, we need to apply them to the skin, not on the clothes, not under clothes. Okay?
Okay.
Picardin is another compound, and this is a synthetic compound made to resemble a natural compound, piperidine. And again, this is found in a group of plants naturally that produce black pepper. And again, Picardin repels insects, make them less likely to bite. Again, it seems to block mosquitoes from sensing their prey. I see Mark being the prey. And again, it doesn't kill insects. And the EPA, again, recognize this as partially non-toxic, which kind of well, how can it be partially non-toxic? Well, again, it's not toxic unless it's ingested or gotten into the eyes where it can be irritating.
Okay. And these are the 2 most common, right?
Those are the
Picardin?
Right. Okay. And the IR3535, oil of eucalyptus, and the 2-ecodinone, they're also available. The oil of eucalyptus is probably one, that people, look at because, hey, oil is something. That seems like it's relatively safe and natural and stuff like that. And usually it is found in a tree native to Australia. And when that oil is refined, it increases the content of the active product. And then is oil of lemon of eucalyptus, which we see available in the United States.
Yeah. So what you're essentially saying is we should grab one of these products, reapply it as recommended, and then we're pretty much good to go? Or are there any other tips you got?
No, I mean, you're going to apply them. You want to apply them often. You go through, you don't want to spray these in somebody's face. So if you're going to put it on your face, put it, spray it into your hands and rub it on people's face. I've already mentioned apply to areas that are exposed, not under clothing. If you need to apply something to clothing, there are compounds that you can apply to clothing that are meant for that.
Okay.
All right, and so that compound that I'm referring to is permethrin, and that's usually about a 0.5%. Typically can found it over-the-counter products, and you might even find it already impregnated in things like mosquito netting and some days.
Cool.
And I honestly, I think that we had to gloss over some of these repellents very quickly. I think it'd be an interesting topic someday to talk about the insect repellents and their effectiveness and safety and stuff like that.
That actually, I like that idea. I don't say that very often to Mike, but I like that idea because then we could bring in a bunch of products and kind of give a little bit of a review. Oh, this one smells
and then we could
terrible,
collect a
or-
bunch of mosquitoes and put them in a bubble and put Mark in there. No,
We'll put
let's
Ben
put
in there
yes,
in
'cause
a tent
with
with
mosquitoes.
a trillion mosquitoes.
I love it.
For
Mark,
like
you're supposed to be
4
on my
hours.
side. It's supposed to be us versus Mike. What are you doing?
No, you're right. What has happened?
So as we're thinking about how to put Ben in this tent of mosquitoes, I think that's a good enough place as any to, kind of swat this episode.
Yeah.
Yeah.
Time to buzz off.
Buzz off. Get the buzz out of here. So until next time.
Thanks for stopping by the Health Deli to sample some of our wares. We're open 24/7 on Facebook and Twitter at The Health Deli, or visit thehealthdeli.com to send us a question or find any of our locations. Please come again. We will be regularly stocking the shelves with fresh content and new wellness specials. As always, we want to give a special thank you to Andrew Tingley and the crew at Ferris State University's Television and Digital Media Production Program. Until next time, so long from the Health Deli, where the topics are tasty, the takes are fresh, and the discussion is free.